Greetings. This is the People-Centered Internet for Sunday, December 3rd. Delighted to have you with us. And today we have a special guest, Gary Kreps from George Mason University. Lynn Wells brings Gary to us, and unfortunately, Lynn is delayed in his flight, coming in from London. So we wish him well, but I'll be introducing Gary. Maybe Lynn will join us in flight. Who knows, right? He's a very resourceful fellow. We first heard, Lynn heard Gary for the first time in September in a Puerto Rican audience talking about the importance of communications in response to disasters. And his talk from Lynn's perspective was remarkably clear and comprehensive, so he asked him to join us. Gary's international work coordinating INSIGHTS, which is the international studies to investigate global health information trends, is in use in more than 20 countries across 5 continents. And he co-directs the Global Leadership Academy, or GALA, to promote the direction of patient advocacy organizations and introductions of customer-focused public policies involving skill sets that will be part of something that's valuable to us as a community at PCI. So I know there's a lot more that you can say about yourself than I said in that brief introduction, Gary. So feel free to fill in the gaps. And we're really glad to have you with us. And as a former meteorology student, I'm really interested in what you have to say. So glad you're here.
Well, thank you. Yeah, I'm basically a study on health and risk communication. I'm very interested in the way that communication provides people with needed information for adapting to risk, to understand it, to prevent it, to react to it appropriately. And it seems to me that we don't really meet the needs that people have with current communication models. So most of the work that I do is trying to evaluate where the gaps are, where the problems are, and how do we improve communication to provide people with the kinds of information they need to coordinate efforts to make good decisions, to help other people, and to adjust in a wide range of situations. So when Lynn met me, I was speaking about a study we were doing in Puerto Rico related to the series of hurricanes that's hit the island over the last several years. And it seems to be increasing not only in frequency, but also in terms of strength and damage. And it appears that, they keep encountering the same kinds of coordination and response problems. And they haven't really built the strong prevention and preparedness models that they need to adapt to these situations. So a group of local folks in Puerto Rico and me, we were working together with a grant from the Natural Hazard Center, which is funded by the CDC, to evaluate what's been going wrong and what we can do right. And so the presentation that Lynn heard from me, that I'm going to use as kind of a starting point for my discussion with you today, was a report to local constituents and stakeholders and first responders in Puerto Rico about what we learned and what they could do. And it was kind of trying to give back to the community. I'm kind of an interventionist in the work that I do. I don't like just to describe problems and issues with communication, but I really want to, to introduce and implement and sustain new models and strategies to improve outcomes in a variety of different ways. I'm particularly interested in health outcomes, but I'm also interested in reducing violence and reducing stress and reducing sadness and all kinds of issues. So it's not just kind of a morbidity issue. It's a really broad set of issues. And I find that it's not just a hurricane issue. It's dealing with any kind of a crisis. I've been very influenced by the work of a guy named Carl Weick. I don't know if you know him. He's a social psychologist. He writes about organizing, and how we need to kind of solve problems and how we live in an information environment. And I've been working with his model and applying it in a variety of different ways. I want to give him credit for that. There's a principle that he has that's embedded in the model. It's a systems principle. It's called requisite variety. And requisite variety says that when you're dealing with a complicated problem, you got to utilize the same level of complexity in the solution that exists in the problem itself. And that's part of the problem, is that we underestimate the complexity of communication, especially in crisis situations. And we act like it's easy to do. And so we end up violating that requisite variety principle by responding in very simple rule-based ways. This is the way I always communicate, when it's not really working very well. People are not understanding. People are not buying into what you're saying. They're not adjusting. And we keep doing it over and over again. So I wanted to try to adapt a more interactive process. And so the reason I'm really excited about speaking with you, because digital channels of communication have become a really powerful mechanism for, allowing more interaction and providing more access to information, and allowing people to connect with each other and work through problems. It's something that White calls communication cycles. And communication cycles are basically interactions where we ask questions and get answers and learn. And the more complicated, or White would call it equivocal, problems are, the more we need to engage in those cycles. And certainly during emergencies like hurricanes, there's a tremendous need for that kind of information and interaction, but it's rarely occurring. It's not happening. We're not engaging in those interactions. And we need to find new mechanisms, channels, and strategies for doing that. So let me pull up my slides, see if it works. Here we go. My slideshow.
We can see it. You're trying to make it full screen now, probably.
Yeah, but the bar at the top is blocking me from getting.
Okay, what about the little icon down at the bottom? That little thing looks like a wine glass. Is that showing up?
No. Oh yeah.
Okay.
Here it is. Here, wait a second. That it.
Lower right.
Yep, that did. Beautiful.
There you go.
Isn't technology wonderful when it works?
Yes, it is.
Unfortunately for me, it doesn't work all the time. In fact, more often than not, it doesn't.
Mm-hmm.
So this is the presentation I did for my friends in Puerto Rico. A lot of first responders, a lot of policymakers. We had a pretty full house of people came in because they were very concerned. That obviously they had a tremendously bruising situation with the last hurricane they went through, and a lot of the long-term implications were still going on. Issues with power outages and internet access and all kinds of water. Amazing how the long-term implications. So they were very interested, and you'll notice that in the presentation I used lots of local imagery to try to kind of help them identify with what's going on. So unless you know Puerto Rico and you've lived there, some of that stuff won't work as well for you, but you'll see how that works. It's kind of part of my communication strategy for making the information more accessible, to make it local. And I think we need to kind of think about it in a very local, community-based way about communicating with people. I added the in paren section at the last minute just the other day. I didn't have that in the slides. It's basically a cheat sheet. This is this is the main message that I'm going to be giving in the presentation. So if you can't be here for the full time, this is it. I believe in strategic communication. By strategic, I mean it's not off the cuff. Most communication is off the cuff. It's not well thought out. It's not really matched to the audience and to the situation. It doesn't really utilize a lot of intelligence. So by strategic, I mean it's providing information, and I take a very strong information-based approach. evidence-based information that's, is correct or the best information that we have available. And so, as you know, one of the big problems we have with online digital information, there's a ton of it out there, but a lot of it is really crappy information. It's not very accurate. It's misinformation. Sometimes it's disinformation. It's it's kind of a dangerous world. So if you're going to be communicating in a crisis, it's really critical that the information you provide is the best available. And even people with goodwill who want to do well often don't do the due diligence to get the best information or to engage the experts or to evaluate what we currently know about the situation. And so we have some people disseminating bad information, which only makes the situation worse. It needs to be adaptive. By adaptive, I mean it needs to fit the unique populations that you work with. And I'm a big believer in audience segmentation, where we segment messaging to match the unique audiences that we're communicating with. And in Puerto Rico, that was a variety of different populations. And we tried to identify them by different groups, by socioeconomic issues, by language issues, by education issues, by occupational issues, by geographic factors. And based on that, we tried to provide information that was most relevant to them. I believe that the best communication is multi-channel, that utilizes a variety of different ways of communicating with people, that mixes as much as possible in-person communication with mediated communication. It means that we need to learn about who the audiences are and what channels of communication they use. What do they like? What do they have access to? What can they utilize well? And make sure that we communicate well with them. If they're not computer literate or not hooked up to the internet, it's crazy for us to only use digital online internet-based channels because we're not going to reach them. We need to figure out what's going to work for them, or at least to find others who can be mediators to connect them to that information. We need to make sure that the information is accessible to them, easily accessible, both in terms of accessing it and utilizing it. So that means a literacy issue. Are they computer literate? Are they health literate? Do they understand the language? We need to make sure that the information matches them. I'm also a huge believer in interactivity. And this becomes a huge problem in a lot of top-down crisis communication, where people are just kind of broadcasting to people, this is what you need to do. This is what we do, that, do this, do the other thing. And most people don't like being bossed around and they don't respond very well to that. And we found that out during the pandemic, that a lot of people were really pissed off about being told to wear masks, which didn't seem to be such a big ask. I just don't think they like being pushed around and told what to do. And so we need to be interactive. We need to engage them and speak with them. And we need to get them to become, motivated to ask questions and to learn and to grow in the situation. We need to be humane. And this sounds like a civics lesson, but during crises, people get uptight. They get nervous, they get angry, they get frustrated, and they're not always very humane, which is really a terrible thing because a lot of times people who are most harmed by the situation are in shock. They're experiencing trauma. And if you can't communicate with them in humane and caring ways, you're not going to capture their attention. You're not going to help them. They'll basically block you out. It needs to be understandable. And as a scientist, I'm very much aware that the language I use as a scholar in my research articles and my publications and in a lot of my professional presentations is not the language that I need to use with different audiences. I need to make sure that what I say to them makes sense to them. And that also means, using examples that they can identify with. The information needs to be usable. By usable, it means they need to be able to do something with it. That it's not just enough to say, this is what's causing the problem, and it's really nasty if they can't do anything about it. We know that fear appeals are good at capturing people's attention, but they will block it out if they can't use that information to find ways to solve the problem, to reduce the fearfulness. It's got to be memorable. Because, a lot of times we have these like one-shot messages, and if they don't remember what it is that you told them to do, they're not going to be able to implement it. And it needs to be immediate. So immediacy is a really interesting concept. It doesn't just mean right now. It also means very involving and evocative and engaging and interesting and dramatic and exciting and personal. And I think that a lot of our communication, especially formal and government communication, really does not have enough immediacy to really engage people actively and to involve them in communicating. So that's my summary. Those are the key points. I figured I'd give it to you up front before I give you the presentation. All right, so hurricanes, and you can substitute any kind of emergency, tsunami, terrorism, active shooter situations, challenge understanding. We don't understand what's going on. We're confused. We're surprised. As Wyke would say, it's a very equivocal situation. It demands relevant, timely, and accurate information. And I think that whenever you're addressing a major health and risk issue, you need to recognize that your primary job is as a communicator. I tell this to healthcare providers all the time. Doctors and nurses think that their main job is to deliver medicine or treatment, but I tell them their main job is to communicate. They're communicators. They're providing information. They're seeking information. They're engaging people. They're helping them to adjust and adapt. And at first, they are very resistant to that. I've heard surgeons say, "I love being a surgeon because I deal with people who are unconscious when they're under anesthesia. I don't have to need to communicate with them." I said, "Well, communication is your primary tool. This is what you need to do." And the same thing is true for emergency management. We need to help people make sense of what's unfolding and how it's going to affect them. And we need to help them identify and decide how to respond. What are the best responses? The most natural responses, like hiding, or closing the door and not listening, getting drunk. Those are not necessarily the best strategies to use. So when you say, what do you do? How do you deal with this situation? And you need to recognize that that's going to change over time as you learn more about the nature of the risk and as things evolve over time. You need to provide help to those who are in greatest risk, which is triage. You need to triage your interventions to identify the people who are most at risk, the people who are experiencing the biggest problems, people who are bleeding, people who need care right now. And unfortunately, we've set up most communication systems to reach the privileged, the people who are not necessarily experiencing the problem, and the people who are most at risk often don't get the information and support they need, which is really a tragic situation. We need to develop strategies to help those affected to survive and overcome, and to inspire them, encourage them to get actively involved, not just to kind of tune out. And so I use as a visual, this is a first alert weather from television that kind of lays out, and I think visuals are really powerful for helping people understand that the hurricane is moving, it's changing, it's going to be in different places, it's going to have different effects, and so you're trying to increase your understanding with that visual. And I used a lot of visuals in this presentation to kind of give examples of ways that you can communicate other than just with words. Hurricanes are confusing and unpredictable, and once again, substitute whatever risk situation could be cancer. Cancer is confusing and unpredictable, and communication must reduce misinformation. I do a lot of work in cancer. Before I came to George Mason University, I was the chief of the Health Communication and Informatics Research Branch at the National Cancer Institute. And I do a ton of cancer communication research because it really deals with the same issues of needing relevant information for diagnosing the problem, for identifying early, for picking the best treatments over time, for dealing with side effects. All these issues are communication issues. So what we want to do is to increase public understanding, which means debunking misinformation, especially nowadays when we live in a highly contested information environment, when we have a lot of bad actors who are providing disinformation on purpose for political reasons. It really irritates me because people are doing this kind of to increase their popularity, get their attention, get political favor, make money. But it's really nasty because it not only confuses people, it encourages them to engage in destructive behavior that causes more problems. So the best way of debunking misinformation is to share relevant, accurate, and timely information, and recognize that this is changing, evolving. The information environment during crisis is changing because the nature of the crisis, the hurricane is changing and moving. Solutions are coming up that didn't exist before. Problems that didn't exist before are happening. Highways are collapsing. Things are happening that we need to adapt to. You not only need to tell people what to do, but you need to provide them with a rationale for why you want them to do what they're doing, what you want them to do. Why do they need to engage? Why do they need to leave their homes? I don't want to leave my home. I've got pets there, well, it's really important to do this for this reason. And this is what we can do to help you. We need to empower people to directly manage their risks, to get involved personally, and to recognize that they're part of a community where they can help others as well. And so people need to kind of recognize that they're interconnected, especially during an emergency, so we can promote coordinated health promotion response, both formally and informally. I find that many times in emergencies, the most important and influential healthcare providers or helpers or risk providers are informal members of the community, family members, local police, other officials, storekeepers, landlords. It's very interesting. Oops, I hit the wrong button. I want people to develop integrated healthcare practices and policies so that we can implement these things now. So I don't just want to do this right now. It's not just kind of a one-time response issue. If we do this, we're going to be reinventing the wheel every time we encounter emergency, that we should be learning from every event and then develop some policies and practices that we can implement and sustain over time to guide this, so we can have rules that we learn from. White calls this organizational intelligence. We develop intelligence based on our experience. Unfortunately, we often don't retain what we've learned. And so we end up going through the same practices over and over again. And that's another communication problem. How do we develop mechanisms or repositories to retain that information? How do we integrate them into the fabric of everyday life? And how do we establish guidelines for addressing future hazards? Because we know that these hurricanes are not just now, it's going to keep happening. And with the acceleration of climate change, we know that the weather is becoming more erratic. And it's the same thing with a variety of different risks. These are not just one-shot events. As White would say, hurricanes are equivocal. They demand effective sense-making. So sense-making is really a critical factor here. It's not one of the things we think about when we think about emergency management. People are not thinking about how do we increase understanding. They're thinking about reacting. Well, reacting is good, but if you don't know why you're reacting, you don't have a direction for doing that work, and you can't retain that over time, it's going to be minimally effective. And people are not going to stick with it. But if they understand, they're adhering to it far more often. They're actually buying into it and becoming part of the solution rather than being part of the problem. So we need to promote awareness about the salience of impending risks. Why are they relevant to you, even if you haven't experienced them right now? We need to deliver relevant, timely information through multiple channels. You're going to hear this over and over again because that's really a critical factor. Many times people are not utilizing multiple channels of communication, so they're not reaching people, and they're not reinforcing their messages with kind of a planned redundance. We need to coordinate policymakers, first responders, and affected groups to minimize negative outcomes. We need to all be working together. You're part of a community. And I mentioned before the principle of requisite variety, that the solution, the communication strategy used, has got to address the complexity of the problem. That if it doesn't do that, you're not going to really help people to develop a full understanding and give them direction for responding. The best communication enables effective prevention, preparation, and response. So prevention is really totally underappreciated in risk communication because we're all about dealing with the moment, dealing with the emergency. But it would be so much better if you could prevent this problem from ever happening. And so prevention is extremely powerful. But people don't understand what they need to do. How can you shore up things so that if you have an earthquake or if you have a hurricane, you have a tsunami, that the damage will not be as great? What kinds of infrastructure do you need? What kinds of warning systems can we develop that will provide early information? What kinds of alternative routes can we have to get out of these situations? What kinds of other coordinated human mechanisms, adaptive strategies, and groups of people can we mobilize to work together so we can prevent major risks and major hazards, prevent death from happening? Once people are dead, they're not bringing them back. So prevention is really critical, and I think we need to think about that ahead of time. Preparation is really critical. So if you want to do good response, you've got to have the policies, the programs, the people. You've got to give them training. You've got to do simulations. These are all communication activities where they're learning their roles. They're learning what to do. And a lot of that can be done online. Some of the best simulations are virtual reality simulations where people can kind of experience what to do, and they can learn what works and what doesn't work. And they can coordinate with people from a distance. And it kind of mirrors in many ways what's going to happen in real situations. And then we need to implement the response mechanisms. We need to coordinate treatment and mitigation, inform and persuade key groups about key responses, monitor what's going on so we can update and provide clear updates, guide future response policies and programs. So this is an ongoing approach. As I mentioned, the issue of misinformation is really a critical problem, and it's becoming a bigger problem. And we're seeing it right now. I've been doing a lot of research on vaccination. Vaccination, if you don't know, is like one of the most important public health innovations that's ever come along. Millions and probably billions of people's lives have been saved around the world from vaccination. But there's been so much misinformation and disinformation that a lot of people are not vaccinating anymore, even for major diseases that we thought we had eradicated. Malaria is coming back, tuberculosis is coming back, polio is coming back. Why? Because people are not buying into vaccination because of misinformation. And this is just one example. It's happening in so many different ways. There's all kinds of folk, law about how to do things, and that really is not based in fact. And then, as I mentioned earlier, there are bad actors who are providing disinformation on purpose for their own purposes. So we need to communicate to enhance understanding, promote collective sense making, share meaningful information about how to select and test different strategies for adapting to these situations that will counter, that will debunk the misinformation. Another strategy, if we learn that there are bad actors out there providing disinformation, is to pre-bunk ahead of time. Say these are not people you should be listening to. These are not good sources of information, and provide evidence for that. And then retain long-term policies for effectively guiding response over time. And in the pictures below, I provide some examples of ways that we've been able to implement information for dealing with these problems. And a lot of these experiences people in Puerto Rico can identify with. So a timely, accurate, and caring information. I wanted to talk about the caring issue. Promotes risk detection and response by sharing the best information widely, explaining current hazard risks and prevention response strategies, providing clear information to audiences specifically that makes sense to them, that adapts to the needs that they have, and demonstrates respect and compassion for the audience. And sadly, a lot of risk communication is not very compassionate, and because of that, is not well accepted. We need to think about, credibility and sources of information. We find that local sources are better often for providing information about local issues. We need to figure out who are the people that people trust, who are the people they listen to, who are the people they respect, who are the people that they can identify with, who are the people who speak the same language as them, who have the right kinds of examples. And this is going to differ from one group to another. We find that local media people are often very well respected and listened to. And then we need to kind of utilize them. I was speaking earlier that we have a program at Mason in climate change communication where we've been using local meteorologists, weathercasters, to provide information about climate change issues, because those are the people that are trusted about these issues. Those are people they visit every day because they want to find out what they need to wear, whether there's going to be a storm coming. But they can also provide them with education and information. And as much as possible, once you can identify through audience analysis, formative evaluation research, who the most credible sources are to different audiences, you employ them as best you can for disseminating relevant information. I also am a really big believer in establishing forums where we interact with people and allow them to ask questions. There are no bad questions. If you are confused about something, I want you to ask a question. I want to hear them. Unfortunately, as I mentioned earlier, much of the communication is one way and top down. It's not interactive. And the more interactive we are with our communication, the more people learn, the more they adapt to each other, the more they build trusting relationships with each other, the greater the cooperation. So interaction is a wonderful thing. It's also great for the experts, because the experts think they know everything. They don't. They don't, because they're not in the situation. They're not in the community. They don't know what's happening on the ground. So these interactive forums not only provide the public and the people who are affected by the situation with information, they provide the experts too, so they can figure out more about what to do and build cooperative relationships. I often find that these forums are really great ways of enlisting people to work with me. I'm a big believer in community-based participatory research, where I work with members of communities. I've learned the hard way that in most of the research where I'm not part of the community, I'm the dumbest person in the room, even if I have degrees and background, because I don't know what's happening to them. They can inform me. They become cultural informants. And they also become my partners in making sense of what's going on and gathering information, in understanding the data, in implementing programs. Sometimes they end up running the programs because they're part of their community. They know where the slack resources are within their community. They know what's been done before. They know what the policies are. And they know the people who can help out, who are interested in these issues. They know the people who are going to be impediments and obstructionists because they're there on the ground. And if you don't utilize that expertise, it's crazy. Use a variety of different media: television, radio, print, online, digital, social media, in person. And this is just a few of the channels available. And often I find that even professional communicators are like one-trick ponies. They know one way of doing it. We're going to do it on the news show. This is it. But you got to utilize multiple channels. You got to make sure that they connect with each other. Different channels have different capacities. Some can tell stories, show video, show narratives. Others can provide detailed information that people can retain and review over time. Others can engage people in discussion and interaction. So you need to utilize all of those channels. And then once again, as I mentioned before, engaging and interacting as humanely as possible with audiences, especially people who are hurting, who are scared, who are having problems, who are maybe experiencing trauma. So as I mentioned, local media, these are, you probably don't recognize these pictures, but these are local media people, local experts that folks in Puerto Rico knew, that they know and they trust these people. They recognize them. So when they tell you something, they know it's real. It's not just some talking head. It's not some guy from Washington who doesn't give a damn, who's not experiencing this problem. It's people who know what's going on, who share a lot of the background cultural experiences that they have. So we wanted familiar and trusted sources for local publics. They can identify with the public. They can use familiar languages and experiences. They know about local resources. They can recommend where people can go for shelter, where they can get food, where they can get water, what kinds of support is available to them, what kind of medical support is available, what they can do. But these people need risk communication training and support. So that's actually our next step in Puerto Rico. We just got a follow-up grant from the Natural Hazard Center for this Puerto Rico thing, where we're going to start implementing what we learned and developing strategies. We're also going to start focusing on not only hurricanes, but tsunamis, which is another big problem and risk in Puerto Rico, so that we can think about ways of developing prevention and response strategies and implementing them. There's a program for tsunamis in Puerto Rico, but nobody's even thought about it. They've forgotten about it. Nobody's following it because it's not happened recently. But if something happens, and we've seen recently with the issues of earthquakes leading to hurricanes and tsunamis in Japan and Indonesia, that this can happen. It can happen very quickly. We need to also find ways of monitoring messages, especially if you want to deal with disinformation. And so we can not only figure out where the disinformation is coming from, but we can gauge public understanding. What sources of information are people listening to? What do they understand? What kinds of information gaps exist within those communities? What kinds of things do they think they know, but the information they have is totally wrong? I mean, that's the worst thing of all. Being confused is bad, but thinking that you know the answers and the answers you have are wrong is really a problem. And and if you don't know that, it becomes a big problem. So we need to kind of implement message tracking systems, and there are lots of really good digital information tracking systems. I've been working with the World Health Organization over the last year, helping them develop what they call an infodemiology intervention program, where they're trying to track where information comes from and evaluate how effective the information is, and then respond quickly when they find false information, and identify who the bad actors are, where the bad information is coming from, and then to kind of warn people about them, and to get people more involved in providing information about what they're learning and what they're doing. The Insights program that was mentioned at the very beginning that I do, it's a research program. We're collecting national data in about 20 different countries, more than 20 around the world, about where people get information related to health and risk. How good is the information? What are the gaps, and where is the misinformation? And what are their preferences, and what can we do for providing better information for them? And now we're doing cross-national comparisons across countries to try and find out ways we can collaborate and cooperate, because many of these risks are not just country-based, they're international, they're global. And so we need to figure out ways that we can share information. And so digital channels become really critical, because they become the very best ways of communicating internationally with people across different borders, across different time zones. So we want to identify misinformation. We want to intervene to stop their spread with debunking and pre-bunking. And then we want to implement strategies to provide accurate information over time, make this an ongoing strategy. And unfortunately, a lot of the major social media companies have basically abdicated responsibility for doing that. They're not evaluating bad information. They're encouraging it. In fact, the X, the former Twitter, is becoming terrible for providing lots of really bad information with no sense of conscience about, even when they know the information is inaccurate. And the other major channels, Facebook and Instagram and TikTok, there's so much bad information. We need to implement strategies for making sure the quality of the information is good, because it's dangerous. It's extremely dangerous. So I want to develop feedback systems. And so this should be one of the policies. This is something that we've learned in just about every emergency situation, that we need to have systems where we can identify what's going on, get feedback and information from people, not only to find out what's going on with them so we can help them, but also to provide them with relevant information and support as needed, and to guide new policies. So public forums, I think, are really critical. We can do this in person if it's possible, within communities, within shelters, within healthcare centers, within schools. We can do it online if people have access. We can do it on television. We can do it on radio. There's lots of different ways of doing these forums. And I think that should be a regular part of every emergency and risk response. We need to educate forum leaders so they know how to communicate effectively with people, to encourage people to share information, to provide good information and answers, to provide follow-up over time. I think that one of the applications of artificial intelligence that people are not talking about is in an advisory capacity, where they can provide people through mobile technology where they live ongoing information about how to adapt and adjust, how to make decisions about purchases, about where to get care, how to deal with problems, what kind of advice, even emotional support when needed on a regular basis. We should have a built-in health buddy that provides information. And if we can network that information to electronic health records and other sources of information, that information can be very targeted. These are the medications that you're taking. This is what you need to know about. These are your diagnoses. These are your genetic predispositions, so that the information is extremely relevant. They can be smart adaptive systems that learn about people, that develop relationships with them, that can share stories, that know about their families, know about their communities. So the information is very personal and updated. And there's a lot of really interesting prototypes of these kinds of models that have been developing that I'm very excited about. I'm working on a big project right now in suicide prevention for transgender teens, which is a group that is extremely at high risk for suicide because of the stresses and stigma and prejudice that they face on a daily basis. And we find that online communication is their preferred form of communication because it's safer, it's easier, and they can connect with other people who are their allies and their friends and their peers. But we need to utilize those channels to provide support, to help build resilience, to engage families, to engage healthcare providers, to provide needed support. And so we're testing different models for doing that on a national scale. And it's extremely promising. It's a really great opportunity. And I think that we can build in some of these kind of health buddy systems that I talked about that can provide coaching and advice on a regular basis, can identify suicidal tendencies and ideology and ideation that people can kind of provide support when needed to help people kind of build resistance and resilience to suicidal tendencies. We need to think about providing updates on a regular basis. Unfortunately, what happens a lot of times is once we have a communication system set, we find the CDC and other organizations do this a lot. They just keep beaming out the same message over and over and over again when that message is no longer good. Plus, people have already seen it. They're not that interested in that information. So we need to provide updated information on a regular basis. We need to let people know up front that we don't have all the information about this crisis, that things are going to be changing. We're going to be providing you with updates as we learn more. So be ready for new information. And as we learn more, we're going to help you to adapt and change over time to not only avert the problem, but to get better, to overcome problems, to improve your lives, to reconstruct, to rebuild your lives. So this is my last big slide. This is the big follow-up. So I think that to really implement these kinds of problems, we need to have certain strategic communication practice goals. We need to develop an infrastructure for sharing relevant information about health risks across a variety of different kinds of situations. These should be built right into the fabric of society. These should be part of what FEMA does, what the Department of Defense does, what local police departments do, what local healthcare delivery systems do. This should be built right into the system. we need to continue to test new communication strategies, models, and tools, especially as we develop new and innovative forms of communicating, of adapting to people, of utilizing technologies in new ways. And then we can disseminate the most relevant information using those best strategies to key audiences. This is a process where we can implement the best practices through discovery, development, and delivery. And I think if we do this, we can really do a good job to help people avert major health risks and improve their well-being. So my last slide is that these are some key references, mostly to my own work, about some of the ideas I talked about. A lot of the models and the theories and the examples that I talked about are in these publications. And I will share the slides if anybody wants to look further at that. So let me stop at this point and open it up to you and we can discuss. I'm going to pull this down if that's okay.
Yeah, that's fantastic. Thank you very much for sharing that. We look forward to seeing the charts. We'll get them out to everyone along with the playback of this call. So let me go to some Q&A now. Ben, you were posting quite a bit earlier in the call. Let me just remind, put it in chat, but I'm going to call on Ben, Coco, Elon, Doug, and Mark. All right. So Ben, you're first.
Yeah, thanks. I did spent some time with Carl Weick, and one of the things that I always took away was the issue of enacted environments. And when we're dealing with a crisis situation of any form, we're dealing with an enacted reality that is different from the prior situation, and certainly we can anticipate changes, but we create ephemeral networks, instead of a broad community-wide. Sometimes I've seen a lot of use in creating ephemeral networks. For example, there's a walkie-talkie application called Zello that folks use in crisis. I remember in Katrina and others, you set up networks for purposeful activity, for pet rescue, for this, not these generic everybody, everything in the cesspool, but they're purposeful and they're trusted agents that are in there. And some of that enactment is ephemeral and not needed prior and not needed after. But during, they need a new basis of trust, communication. That's just one of the comments that came to mind. I wanted to get your thoughts on that.
Yeah, I think the issue of the enacted environment is really critical because we realize that people are not dealing with an objective reality. It's extremely subjective. And the reality is also based on their community and who they're communicating with. And so in many ways, if we can provide people with updated information to kind of help them improve their perspective on reality, to help them understand more clearly what's going on, and to debunk what they don't understand, well, may be misinformed about, we can really improve that information. But but people are always kind of dealing with it kind of on a flat dimension, that this is real, this is what everybody thinks, this is what everybody sees, and it's not true. It's all enacted based on the communities and the information that they're receiving.
Yeah,
I want to add before
experienced that with Katrina, that Zello created different communities, different spheres of interchange. It required cellular access to retain, and so that might be a constraint on some. But the notion of context brings a whole different enacted reality that is ephemeral too, and you have to design what stages of existence of that context. Thank you.
I agree.
Right. Thank you very much, Ben. I don't see Coco on camera, so I'm going to go to Elon next. Please join us.
Thanks very much. And thank you, Gary, for really insightful and I think very important presentation. There are a lot of important points in it. Quite a remarkable tour de force, I would say, in terms of communication. But I would actually broaden it. It's not just about communication in that sense, in the usual sense, but as you clearly point out, it's really about sense making for making decisions. And these are decisions taken under duress and therefore very difficult. And in which I also think you made clear this has to be grounded in the communities that are exposed, not in some abstracted, or averaged global whatever. I mean, there's a broad frame, but we need to be based in the communities. A couple of just sort of, for me, framings that I want to just reinforce from what you said, and that is, one is about the sense making to make decisions, but second about resilience and adaptation, that we're really after creating resilient environments and resilient communities, but that also means that there has to be an effort, not just to communicate, but to engage, as you said, because it's about their vision of their future and their resilience. If there isn't any of that vision, which may be expressed as what I'm interested also is in the narratives that contain that sort of core idea, if that isn't there, there is no engagement, there's no investment on part of the community in that future. And maybe the last thing I'll mention is that just another way of saying some things you said is the question of how you engage the community, both directly within, but also outside, in generating empathy that understands, that engages with the reality on that ground. And we are not very good at that. And in fact, what you talked about, the misinformation, it is so devoid of any empathy that's part of its terrible impact, is my sense. Anyway, sorry for sort of just going back over what you said, but trying to put it a little bit in terms that I mentioned. I also left in the chat the connection with the iDream Society, which I'm on the board of, and which deals with many of these issues. And Japan, as you well know, has done a lot on disaster risk prevention. And the Disaster Risk Prevention Institute at the University of Kyoto, where I've spent some time, is also an interesting resource. And I think would be very interested in your perspective. If you haven't worked with them or talked with them, I would love to put you in touch with several of the people there.
Yeah, actually, I'm working with a lot of folks in Japan right now. Japan is one of the sites for the Insights research program through the National Cancer Center in Tokyo. And we've been doing a series of studies about where people are getting information about health issues. And we've been finding out that there's lots of huge gaps and problems with information. And the Japanese government has not always been very forthcoming with information. There's kind of a paternalistic cultural model of we'll tell you only what we think you need to hear, and so people are not very well informed. We saw that during the Fukushima, tsunami situation. That don't worry, everything is cool, no problem. We've got it under control, and when in fact it really wasn't under control, and there were radiation problems. And so I think that this is really a real important message. I love your idea about narrative too, and sense making, and thinking about what the future is, and having a plan for moving forward. Because I find that when people are hurting and are in shock and in trauma, they often despair. They're not thinking about, they think it's all over, that, this is, my life is over. But I think that hope is really critical. I was watching a show the other day about Lahaina in Maui. That there was a group of surfers, local surfers who worked together to try and help people in Lahaina to rebuild and to adapt to the terrible fires that happened there. And a lot of that was kind of building the sense of kind of there is a future for us here, because people were not really seeing that. Albert Bandura has a wonderful model about how we understand the world based on modeling others, and we learn about that through those kinds of stories of success and adaptation. So I love the ideas that you presented. I really do.
Just very briefly on that last point, we just recently, well, now I guess 2 years, published a paper in Futures on a digital observatory of narratives of sustainability. I mean, it was focused on sustainability, but the risk issue is part of that. I mean, you can't, if you don't survive, you don't sustain the life. But part of the point is that the risk in the misinformation has also to do with this many-to-many communication, which is now what everybody is using, as opposed to top-down, which is good and it's bad. But it's one way of looking at those narratives.
Great points. Thank you.
Absolutely.
Thank you.
I just wanted to, jump in on the comment that you made about Japan. Is about a month and a half after Fukushima, I was in Tokyo, very dark at night, right, because they turn a lot of stuff off. And the newspapers had the weather report and the radiation report, okay, coexisting in the newspapers. And, which way was the wind blowing? How many, rads were you going to get today, right? And, while the government was not particularly talkative, that particular infographic spoke volumes about what you should be doing that particular day. So it's just interesting. I
think it really affected public confidence in the government too, when they saw the kind of information that that was more scientific, that didn't match the messages that the government was giving, that people felt really betrayed. And there was lots of bad information about whether food was safe and not. And, they were feeding kids milk with radiation. It was just bad.
Yeah, understood.
There's also a great deal of social tremendous stress. Yeah. Families moving away, often parents having to separate because of social stigmas and things like that. So there was a lot more there than just the radiation and the technical part. And I think that's also, which you brought up, Gary, is, that's part of really understanding more of the sense making and of what the social underpinning, where very much of the conventional approach to risk management is around the technology, or the technocratic, let's put it that way.
Yeah. Okay, so I want to point out that we are now at the point where we say thank you for joining, because we've gone through our first hour. Gary, if you can stay, we have an overtime session that goes for a half an hour, where we still have some questions queued up. So if you can stay, we'd be delighted. For those of you who have to move on because you have other obligations today, we want to thank you for being with us. Coco, are you, I saw in chat that your power went out, but I don't know whether you're able to join us. You had a comment. Glad to have you join us.
Yes, thank you, sir. Thank you, Professor Gary, for this excellent presentation. I really thank you, because it responds to my expectations, but not only my expectation, but it boosts me. It's trying to boost me, because at my place in Goma, in Congo, in the eastern of Congo, we always deal with disaster of volcanoes. And really, I can say that your presentation is totally the copy of what we can use like as a solution in our town. Because United Nations tried to give help. We found out the observatory teams to manage all those stuff. They don't have tools. They don't have anything. But now I can see that from the tools you specified in your presentations, I can build them and do it for them. And
Excellent.
really, this is give me it boosts me. It boosts my willing to do something for my place. So thank you very much, Professor Gary, and thank you, Mr. Kevin, for this opportunity again to be here.
All right.
And if you can allow me, I have another session to follow right now to
Well,
prepare one session.
But thank you for your
friends.
comments, and we hope your power comes back soon.
Yeah, thank you.
I
so
will come back after 3 days. After 3 days.
All right. Very good.
Thank you so. Thank you
I'm
so
going
much.
to
Sir. Thank you.
ask Doug Hoolan to join us. Doug?
Yeah, trying to get off mute. Yes,
problem.
Gary, really good presentation. You touched a little bit on personal health information, and that's something that's near and dear to my interest and heart. 25%, or excuse me, 50% of people don't follow their treatment plan, and 250,000 people die every year from medical errors in the United States, and estimated that 5% of people around the world die from medical errors. So I guess my question to you is, what things are you working to put in place to help more personalized medicine? I'm working on artificial intelligence projects, and so that's one area, but just if you could expand on your comment there, I'd be interested in that.
Yeah, thank you for that comment, Doug, because this is an issue that's very important to me as well. I've done a lot of research on medication adherence, and you're absolutely right. Even people with chronic diseases who need to take their medication to stay alive are not following their medication prescriptions. They're not taking the medication. And you're right, 50% or more are not following the recommendations. And we find that mostly it's because of bad information, that they don't really understand why they need to take the medication. They don't understand how to take the medication. They don't understand how to get the medication. They don't like the way the medication makes them feel, and they don't know how to deal with the side effects. And so one of the things I've been doing is trying to develop some information strategies for helping people to adapt, to ask questions, and so to get information about ways to better understand their health experience. I see it as really a communication problem at the point of prescription or the point of providing treatment, that the information was not really provided clearly or fully so that people really understood what they were being prescribed and why they were being prescribed, or even what the nature of their healthcare problem was. And the time wasn't taken to really help people understand. I think this is done on a relatively shallow level, where the provider might say, well, do you understand? And what is the patient going to say? No, I have no idea what you're telling me. They don't want to look like an idiot. They don't want to insult the provider. So they say, yes, I've even heard people say that in a different language. See, but they don't understand. And so they need to ask a better question, like, what are you going to do next? How are you going to deal with this issue? And that's not happening. So I think we need to do a better job of training healthcare providers to be better communicators and to evaluate. And we also need to provide, as I mentioned before, feedback loops. What do people understand? How are they dealing with their medication? I did a study a number of years ago with people who are getting chemotherapy, veterans from the Veterans Administration, and we gave them what I call the Health Buddy little computer system in their house that they would provide feedback on a regular basis, answer a couple questions about how they were doing, just kind of click on things, and it would identify anytime that their answers were out of parameter, whether something was not right, they would get a follow-up call from a nurse or a social worker saying, "What's going on? How are you doing?" And oftentimes it involved helping a caregiver provide better care. Sometimes it meant that the person had to go to the emergency room. But whatever it did was, it was a way of trying to update the information. And without that, nobody would have ever learned about the problem. And so we need to provide a more comprehensive communication system. And so a lot of the work I do is based on trying to enrich the communication, so the quality is better, understanding is better, feedback is better, and adaptation is better over time.
Yeah, one comment is JAMA did a report that compared AI responses to doctors' responses, and people rated the AI system as more empathetic and more accurate. And that we got to change that, because the doctors are still more accurate. They may not be more empathetic, but we need to understand how to put in a system in place that makes people engage with the human and not with the AI.
Part of it
Maybe
is a
the AI
systemic problem.
diagnosis will challenge the doctors to get better at
Yeah,
delivering.
exactly.
Well, part of it is a problem with the doctors are in kind of an untenable situation where they need to kind of respond quickly. They're being evaluated on volume rather than quality, and they in and out. You just kind of push them through. And so with the AI, with the computer systems, computers are ultimately patient. They will stick with you and answer questions as long as you want, and that's not a problem. That's why it's really a good adjunct to the doctors, if we can have that as kind of a backup system. And then if there's a problem that the computer can't help the patient with, then you can connect them back to the healthcare provider.
Yeah. Thanks for coming to see me. Keep on talking to my computer. All right. All right. Thanks, Doug. Appreciate it. Mark, glad you're with us. Questions, comments for Gary?
Thank you, Gary. This was a very fun and comprehensive presentation. But let me suggest one other thing that you might want to add, which is growing a solution. And the way we do that is we start with the young people. And as everybody knows here, I'm very invested in young people and think that they can do much more than we give them credit for doing. So my question is, I wonder, have places like Puerto Rico, like other islands, like any place, even in Japan, that have a lot of emergencies, ever thought about creating something like an emergency youth corps where kids like the IDF are required to go to this? It's not school, because school doesn't do the right things, but it's a corps that's organized, that has some authority. And so when something happens and the young people say, this is what we should do, they have some authority, which they're happy to do and capable of doing, but people would tend not to listen to them. We see kids as, oh, they're the victims of this terrible tragedy. What if they were really a big part of the solution to this tragedy? Is anybody working on that?
I think it's a great idea. A number of years ago, I was doing a project when I was at the National Cancer Institute with Peter Salovey, who's a psychologist. He's now the president of Yale University. At the time, he was the chair of the psychology department at Yale. And we were doing a project on providing cancer information to low-income families. We're working with a Head Start program. And so we developed an intervention where if we got families to come in and to learn about searching online and getting information, we would give them a free networked computer to kind of get the information. But we found out pretty quickly that the most savvy members of the family were the kids, that they knew how to work the computers. And they became the most important part of the family for helping them to utilize and access the information. And it really pointed out what you were saying, how important youth is. And I'm a really big believer in intergenerational communication, that it's really important for us to communicate across generations so we share information, and not just from the top down to the kids, but from the kids back up, because the kids have a lot to offer. They know a lot. They know a lot about what's going on in society. And I think that kind of collaboration is really good. Plus, we know that people like intergenerational communication. The kids love it. The grandpas love it. Everybody likes it because it's kind of sharing across generations, and we've got to kind of build that in. So I think it's a really clever idea, and I'm going to look into doing more. I'm not doing much with it now, But Mark, you planted a really great seed for me.
I would love to help if you ever want any help or thinking about that. That's what I do a lot. And as Ben pointed out in the chat, the air wardens, the Boy Scouts, people have done this kind of thing in the past, but we could do it much more systematically in every country that needs it, and really have the young people be a huge resource.
Yeah, we're doing part of that in that suicide prevention research program that I talked about. Where we're using peer support from kids, but we're also helping them to communicate with the parents and with the providers, help them understand what the issues are, what the concerns are, what the stressors are that the young kids are facing. And it's extremely powerful.
All right. Thanks, Mark. Greatly appreciate it. Suzanne, I'm asking you to join us. You made some comments in chat, so come on in.
Oh, thank you very much. Gary, very informative presentation. I really enjoyed it. I completely agree with you. Your last slide, however, was the one that really resonated with me. Like Doug, I'm working on my next publication on artificial intelligence and how it could play a huge role for community good, looking at it from a One Health perspective of the globe, is space, climate, public health, which definitely needs to be overhauled, as we all know. But where do you see artificial intelligence benefiting future goals? I'm going to backtrack just a moment here. Looking at your last slide again, that was very informative. In developing this infrastructure that you're proposing, which is desperately needed along and amongst all critical infrastructures. In developing this new infrastructure, where do you see space-based applications? Obviously, to get the information to, for example, with Puerto Rico, what we've seen in the past with the crises that they have endured, what we've seen go on with Ukraine. And it's fascinating because what occurred in Puerto Rico and how it was tracked and it was disseminated with the media, it's so different with Ukraine. And I see a great deal of improvement with the communications that we've witnessed. Where do you see AI helping this in the future? Or do you see it as having a place for predictive intelligence, perhaps leveraging all critical infrastructures to help us prevent? And do you see us making any progress in this area at a policy level where change might happen so that we could get the investments before certain things?
Great question. I mean, I think that we're going through kind of a really interesting shift in the way we utilize computers nowadays. The big change initially was to computer-mediated communication, where the computer mediated and connected people. But now we're moving to a kind of a human-machine communication, where instead of connecting people, people are communicating directly with the computers themselves. And I think that's a really big shift, and it's a place where I see artificial intelligence playing a huge role, especially developing smart, adaptive, relational computing systems that can get to know people and work with them and advise them and consult with them and provide support on a regular basis. I really foresee in the future that we all will have our own personal coaches or social support mechanisms through artificial intelligence, probably with a kind of a humanized, like a virtual human agent kind of a avatar-based system, where people, communicating with the computer, with the machine directly, and providing them with information. I don't think that's going to be the only sort,
Right.
but it'll be one really active, easy one that can actually invite other people to be part of the conversation as well. So it will be a connection. Last year, I edited a special issue of a new journal called Human Machine Communication. And it was about the applications of human machine communication in health. And we wrote an article in that special issue, my colleagues and I, that was focusing particularly on the pandemic. During the pandemic, when people were highly infectious, it was very difficult to kind of communicate with them directly. But the machines were not infectious. They weren't carrying the disease. They weren't going to catch the disease. It was an easier way. And so we talked about the use of robotics and artificial intelligence as ways of delivering care in a highly infectious environments. And I think that that's kind of an interesting model for where we're going to go. I think that artificial intelligence is going to be really important for building systems that will be providing meaningful information. And I think this is going to happen at all levels. I'm working on a project right now to utilize artificial intelligence to advise physicians about prescribing for depression. There's a lot of weird guidelines about depression medications. Some of the depression medications that people are giving are really dangerous. They actually make people feel suicidal and cause problems. And there are a lot of guidelines, but there's so many guidelines that it's very difficult for the doctors to keep up with them. And it differs for different patients based on their other medications they're taking, based on their predispositions, based on their health histories. But we're developing a system that can check into all that information and advise the doctors about what's appropriate and best for a particular patient so they can make good decisions. And I think we're going to see a lot more of that kind of advising, not just for healthcare providers, but for everyone. Because the computers have much more capacity for processing information. And since so much information is networked now, there's a lot of that information available. So we should be utilizing that intelligence for guiding decision-making. When I talked about earlier in my presentation about communication cycles, about trying to unpack equivocal situations with information, with interaction, I think that we should be interacting with artificial intelligence more often as a way of trying to unpack complicated situations to make good advice about helping us to understand and respond. We're not utilizing it nearly as much as we should.
I agree.
All right.
Excellent.
Right. Fantastic. So that is the group of questions that we had. I'll go, since we just have a couple of minutes left, I'll do a last call. Does anybody else have a question for Gary before I start to wrap it up?
Yeah, one comment, talking about your agent. Have you tried Pi AI at all, Gary?
No.
So I recommend, I put it in the chat, pi.ai, and it's Inflections, Solomon's company, and it's the second most powerful AI tool, and it's free to use, and it's well worth trying out as an AI agent, personal AI agent.
I'll check it out. I'm working with a bunch of informaticians, computer scientists on this, and who are way more sophisticated than I am. I'm kind of a social scientist. I'm not really a heavy tech guy, but I'll share that information with them. They probably already know about it. But thank you for the information, Doug.
Yeah, that's great. Well, you know what? As long as you know somebody who's using AI and they're willing to help you, you're in good shape, right? It's the people who don't know anybody, right? They're going to have some problems, right?
And
so thank
Kevin,
you.
I would really like Gary's slides. I would really
He's
like
going to
to
send them. Yeah, we're going to send them around along with the recording, Suzanne. So that's great. So thanks for sharing that. If you want to do anything with Gary, Gary, you can put something in chat. I know that we had your contact information on the first chart, but if you just put it in chat, all right, that'll allow people to interact with you. And I want to thank Lynn Wells for making it possible for you to join us today. He was spot on. You were a great person to join us. You clearly sparked some good conversation, some good dialogue here, and we like what you're doing.
Thank you. Put me on your mailing list. I'd like to join you guys again.
We absolutely done. I will just say, Schneider Alfonso, when you listen to this recording, add Gary and I'll make sure that I do that. He is he's our tech person and our person that makes sure that all the trains run on time, Gary. So there you go. Schneider is key talent. And like I said, thanks for being with us, and everyone and everything you do, be intentional. We'll talk to you. Our next meeting is the last one of the year, and it is our year-end party. So take care. We'll look forward to having you with us, Gary. Cheers.
Bye.